What about with implants? We know that our healing of bone and soft tissue is delayed, especially when patients are hyperglycemic and not well controlled. But there's a pretty high variation of implant survival rates. And I think the reason for this is mostly because the studies are nowadays looking at controlled versus not controlled diabetics. And if we have well controlled, non insulin dependent diabetics, we can get pretty high ISQ values that we would be comfortable performing immediate loading in. And so you can see here, if we don't have a well-controlled patients and we don't have good ISQ values, then we're not going to be comfortable in that area. And of course, if our hemoglobin A1C is high, we're going to have a decrease in implant stability, and we're going to require longer-term healing, which would again go against immediate loading and immediate placement protocols. So really, overall, it depends on glycemic control. And most of the studies out there that look at positive results after immediate loading and implant placement are going to be those well-controlled diabetics, as you see in some of these studies that I've cited for you here. And if that's the case, then we generally have good implant survival. So we looked at that again in this study, and we looked at quite a number of studies. We looked at 29 and then included 20 of them for this analysis of osseointegration. And what we found was that there was no decrease in implant osseointegration in diabetics that were well controlled, but potentially some increase in complications in peri-implantitis, especially in poorly controlled diabetics. And of course, you can select your case to place implants in well-controlled diabetics, but you don't really have a control over how well they're going to manage their diabetes over time. And so that's why, the studies that look at complications had some poorly controlled diabetics in them, because these were patients that already had their implants in place.